Welcome everyone. Thank you for joining us today for the Mayor's Business Town Hall. Today we're joined by Mayor Joe Curtatone and Mayor-elect Katjana Ballantyne. We're going to go through some updates related to the public health mandate proposed for January 14th. To start off, we just have a quick overview of rules of engagement today. We're using Zoom. We'll do a short presentation with some data slides, get into the proposed mandate. We will be taking Q&A. I'm going to disable the chat function and primarily we'll use the Q&A box to address questions. You'll also have the opportunity to be unmuted and share your question directly with the team. So you can raise your hand for that function, and also we will be recording this meeting and it will be available for folks that weren't able to make it. The agenda here, we'll start off with a welcome, get into the data and then move on to Q&A and an economic development update. And I think with that, I'll hand it off to Mayor Curtatone.
Thanks, Nick. Good afternoon, everyone, and happy holidays and happy New Year. I hope you're all well during, again, these continued tumultuous times, but I want to remind everyone, first as I welcome you along with my colleague, exciting and newly elected Mayor-elect Ballantyne, will welcome you as well. Thank you for all you've done to work in partnership with us to take on the pandemic, your advice and perspective during reopening and striving to keep our whole community safe as well, obviously as your employees and workers and customers as well appreciated. I am first going to hand off and welcome the Mayor-elect and commend her on an exciting announcement that she's building her administration and assure you all that we are working in close coordination and collaboration for a seamless transition, which will happen 6 days from now, but I'm not counting. Madam Mayor-elect, I'll allow you to welcome everyone, and I'll take it back.
Good afternoon, everybody. Thank you, Mayor Curtatone. Thank you for working with me and my transition team on making as smooth this transition as possible to you all. And I certainly want to thank the business community for all you've done during these unprecedented times. And, I look forward to working with you, hearing what you have to say, being challenged by you as we move into the next year. Thank you.
Thank you, Madam Mayor-elect. Before I say a couple other words, Tom, can we just introduce who's going to be speaking today before I hand it off to Sam? I'll say a couple other words.
Yeah, Mayor, from my office, we have Nick Schoenberger, who has already been introduced, Rachel Ned-Carney, who will be available during the question and answers. We also have Adriana Fernandez, who's I see in the room as well, and also William Blackmer. So we've got a full crew from economic development on board.
Great. And then thank you, Tom, to all your team for all you've done for the business community and the whole community. I also want to, for those you haven't met, and welcome the city's first ever emergency management director is Mr. Justin Cates, who joins us from the land up north in New Hampshire. We're excited to have Justin here on the team and welcome him to this call. Justin, I don't know if you want to mention anything. We'll say hello.
Yeah, no, thank you, Mayor. And I look forward to assisting, especially as we continue to move into the next surge of COVID and working to identify opportunities to collaborate with the economic development team and the rest of the city departments on the response to COVID. Thank you.
Great, thanks. So not to beleaguer things here, we had set aside 45 minutes, but we didn't really start till 3:10. So we're going to go to 3:55. We're going to be direct. And as always, we're going to be ethical with what we know, what we don't know, why we're making recommendations or decisions as we put forth. First, again, thank you for all you've done in partnership, as the Mayor-elect has mentioned. We need your continued assistance and collaboration, your perspective on how to do things well. I know we're done with COVID. Personally, is not done with us. We either control the virus or it will control us. And I want to remind everyone there is still human suffering going on. We lost our 100th soul just a few days ago. And I can tell you, as you've heard me time and again, those are the worst calls to get. As a man, I know the Mayor-elect doesn't want to get them. So I know we all share the same values, keeping everyone healthy, safe, and alive. And we can do this in a smart way. So we're going to go through some data first. And then at the end, we'll talk about where we are and some current economic programs, what we're considering, talk about what has been proposed and being considered by the Board of Health in that process. Then take your questions. But again, thank you for joining us. At this time, I want to introduce you, for those who haven't met, Sam Schaefer has joined the Somerville team recently. He's been a big add, and we're excited to have him aboard. and he's heading up the data piece on the ICS as well. Sam?
Thanks, Mr. Mayor. So we'll start by taking just a quick peek at a screenshot from the COVID dashboard that's updated at least every Tuesday. These days it's updated a little bit more often because COVID spread is super high, but I'll just call it a few. This was as of at close of business yesterday. And these are sort of much bigger numbers than we would have seen the last time this group came together. Of note, as the mayor mentioned, we crossed the 100 fatality threshold pretty recently. Also, our test positivity is the highest it's been since the very first surge early in 2020. And again, confirmed cases over the previous 10 days being 676 is really, really high. And then again, average incidence per 100,000 residents. That's sort of a way that we can compare Somerville to other cities and even states or countries, seeing over 80 cases daily per 100,000 residents, averaged over 14 days. Can we go to the next slide, please? This is over time, we can see the really small lines, which in this picture won't show anything. But again, this is on the public dashboard, and you can zoom in really far. Some takeaways here are to look at the blue line, which is the 14-day moving average of new confirmed cases within the city. We can see last in the chart around January 1st, 2021 was sort of the winter peak last year that we all remember. And our blue moving average line has surged recently, sort of right through where the pandemic put us last year. Just to put sort of a number on it, last winter we were around 45 new cases per day at the peak, whereas right now we, as of yesterday, we had over 66, which is that top kind of bolded black number there. As a comparison, the lowest that we had seen was in late June at 0.36. So this is this is like one new case every 3 days, compared to now 66 cases a day. And then to kind of just put that into comparison, this last text box, that's about 180 times higher right now than we were at the lowest point earlier in the summer. Can we go to the next slide, please? Here's a snapshot of the vaccine status, sort of the city at large. I think, since summer, we've seen about 10% of people in Somerville become fully vaccinated to put the total city population at about 80% fully vaccinated. This is for all people, so not only age eligible people. So just kind of thinking about that context, that's much higher than most other communities, nearby or nationwide even. Can we jump to the next slide, please? As a comparison, so these percentages are slightly different. So comparing one to the other is not a perfectly data valid exercise, but this shows county by county comparisons. We can see Middlesex County in there, is the highest in Greater Boston, and we can see some sort of still high 60s in other places in the state. But again, just sort of seeing a county by county comparison here. And then again, that fully vaccinated individuals in Massachusetts number, which is as of, I believe that date is as of December 21st, but over 5 million people are fully vaccinated in Massachusetts, which is really good. Can we go to the next slide, please? Finally, we'll take a peek at 2 slides that show trends over time. So these are all statewide, so not any longer kind of limited to the city or the county. On the left, we see the 7-day moving average for confirmed. So this is PCR tests, this lab confirmed PCR confirmed cases. We got up statewide, we got up past the peak from last winter. And again, I just want to call out the last couple of days of the state data sometimes is a little bit incomplete. So that sort of like downward trend at the end of that blue line should really be thought of as incomplete data, not necessarily a kind of decrease in cases. And then as for testing on the right side here, we can see that the positivity rate has gone up a lot. It also has gone up past where the positivity rate peaks last winter, and certainly is higher than sort of the smaller scale surges that we saw earlier this year, sort of later in the spring and then again over the summer. Could we go to the next slide, please? Finally, we can take a peek at hospitalizations and deaths. We see that hospitalizations and deaths are both not up to where they were last winter. This is likely a combination of 2 things. First of all, the vaccine status of the city is likely going to lead to decreases in hospitalizations and deaths sort of on a per case basis. And then again, also these lines tend to lag a bit behind the COVID confirmed cases numbers because of the time it takes between testing positive for a case to needing hospital care and then to dying in the rare event that happens. So just can take a peek over time here and see the comparisons. And that's all I have on COVID data.
So I'm going to, thanks, Sam. And again, we'll take questions and comments at the end so we can get right through the slides. We don't have many folks, so appreciate your patience. I'm going to speak a little bit an overview as what has been proposed. Those who followed, the Board of Health met last week. They began consideration of public health order, which is outlined in this slide here. And really, also we're not only all in on this and proposing it, but we're excited about the best strength and regional collaboration we're seeing, led by Mayor Wu in the city of Boston, really focused on areas of high concern and super spreading, indoor entertainment, recreation, and event venues, restaurants, bars, gyms, and fitness centers. But as we think about this, we're going to make clear, I think this was important, and I'll use a personal experience, but we've all had this experience. We've had to show our ID, and people still have to do that today at a certain age where they think some of us are still young enough and flagging when we're asked for ID to buy alcohol. That's how seamless the intent is in trying to do it. It's very simple. In a recent trip I had to Canada a few weeks ago, in addition to all the requirements of getting in, anywhere I went, whether it was a coffee shop, a restaurant, I was asked if I was going to eat there, and as well as anyone else. And those venues were filled. Everybody was masked up as when they should be, and they were proud to show their vaccination documentation, including in a hockey rink. And I will tell you some feedback I got from the workers and the customers. They appreciate it. Give them confidence to go to that establishment, confidence to work safely, and businesses appreciate the activity is picking up and will stay stable. But again, it's really a simple approach to make this as seamless, as easy as possible to do, to present that verification. That is the intent behind the order, and really to have an even strengthened regional approach, which is well needed here. As we know, the virus has no boundaries. It will find a way. Next slide, please. So the order that is, again, being considered would require a proof of vaccination. And nothing here is meant to be, in terms of enforcement, to be punitive, but it is going to be incumbent upon those who it affects and applies to much like you would in ascertaining that someone's ID is valid and that the appropriation of alcohol or any other requirement, the same way that it is an official proof of vaccination. And we're offering and supporting several ways of doing that. I will say it is frustrating that in this country, it's not just a state country, there's not a very easy way with all the technology we have in every one of our states to upload with some QR code your proof of vaccinations. Having been in Scotland and having to do that to the national health system, it's baffling. And we've put an emphasis on that. I can tell you, in working with other regional cities and really across the Commonwealth and in meetings with the administration, it is a focus to make sure you don't have to carry that clunky card around, which I, for one, it's just a matter of time before I lose mine along with my keys and wallet, but you can have it digitally uploaded and easy to show as you go to any establishment. And as we can foresee, it's probably going to be the case for domestic travel and other things moving forward. But here, really, the examples are the many following mechanisms you can use to show proof of vaccination, and it leaves the flexibility because there will be an app. It is either being developed, it will be implemented soon, and either endorsed by the city or the state. But there are other opportunities to show something, technology that might be able to be utilized now. So again, not to be stringent, and we're going to need your perspective on how best to do that. Some of you are already doing this in your establishments. My gym started doing it back in the spring when the CDC guideline was you can take off your mask in these establishments as long as you show proof of vaccination. I mean, they just recorded it in a very simple way, and people are proud to do it. So it's not, we were trying to make sure it's not a punitive, not a stringent, not a heavy lift. Next slide, please. Okay, there are exemptions in the order we put forward. Some may say, and I've heard some questions, how come we exempted this or not that? The intent is to be as consistent as possible, and notwithstanding all the efforts we've had in the many months past with the region in a very basic form. But that's not to say the Board of Health, again, they're an independent body appointed by the mayor, confirmed by the council. That's not to say they won't deliberate and consider further exemptions or removing exemptions or other requirements. This, at a minimum, is the things we should be doing. We'd submit, and it'll be up to their consideration as to whether these exemptions apply or others should apply. But they're pretty simple, pretty straightforward, as is with the ways, the means by which you can show proof of vaccination. Next slide, please. The city, as all, we're going to commit ourselves to work in partnership with you, and we need not only a partnership, we need your perspective, we need your input as we think about what we're providing signage and the other ways we can help to make sure that we are able to put forth reasonable efforts to secure voluntary compliance. We're not here to try to be punitive, but make no mistake, this will be a requirement if adopted by the Board of Health, and we will pursue those who willingly do not comply with the law, as we've done. I know that's not going to be the case for the overwhelming majority of establishments here, because they all care about the health and safety of our workers, our customers, and our community. And I will say this, the more we can show our overall compliance and partnership with this, the more confidence will increase in the consumer base here in the city and those who want to come to the city and workers to come to work and keep everyone healthy, safe, and alive. So we're going to need your input, and I'm going to talk a little bit later about what the city will be in position to do. I can't remember if I have another slide. As much we work together, for example, on the small business assistance and COVID relief fund reform, the leadership of Mayor-elect Ballantyne and the council and others, which was unprecedented. I don't think any other Massachusetts community did that. We put up millions of dollars directly to small businesses and their employees, and we're in position to do something else here. And that's why we're going to need your perspective to understand fully what will be needed to achieve what we want to achieve. And you know better because you're doing that work on a day-to-day basis and can give us guidance on that. Next slide, please. The phases, again, as has been proposed, again, this is subject to the consideration and disposition approval of the Board of Health. So they, as you know, the Board of Health, and if you don't know, they continue their meeting. It'll be taken up on January 14th, given by their comments, because they're very strong. I suspect they will approve something, whether they approve the effect of the 15th, but it's not out of the question that, for example, they say, well, it's the 14th, maybe phase one will be by the beginning of February and the January and so forth. Given now our vaccination rates are really high and good, but that doesn't mean every city is. But given the 1 dose requirement at that point or 2 dose, we feel that would not be anything that negatively impact if they did that. But we did this also in have to be as consistent as possible with the rest of the region, which is moving in that direction, I'd submit. Again, this will be up to the Board of Health to determine the timing and the phases and what will be part of that phase. Next slide. I'm going to head it off to Tom Galligani and his team on the economic development updates, and I'll talk about the expanded round 3 the monies we had left over from the previous COVID relief. And again, I just want to say, we're in a position to work with all of you to provide resources to help us achieve compliance. We're going to need that input from you, as you did during the reopening phases, and during the fostering of the relief funds and the creation of the relief funds that we put forth so many months ago. Tom, back to your team.
Thank you, Mayor. Next slide, please. Just in summary, a lot of you have already participated, and I appreciate your partnership over the last year and a half, almost 2 years now that we've been dealing with COVID and the impacts to our businesses and to our city. The city has distributed over $2.2 million to almost 200 businesses with the city's own COVID relief program. This is in addition to the first 2 rounds of COVID relief that we provided using federal resources, and also the relief that we provided in terms of fee relief and fee waivers for restaurants and other businesses last year. We're in the process of expanding our so-called round 3 of city-funded relief, and we're going to expand the types of businesses that might be eligible, and also expand the scope of awards. And so we will allow businesses to apply again if they are showing still a dramatic need. They'll be able to apply again and receive additional funds. These details are still being developed and finalized, and we'll be posting them shortly on the website. In addition, you may have noticed, I hope you've noticed, our COVID ambassadors that have been walking through the city, handing out masks, stopping in with businesses, sharing information about vaccine and testing information, and any and all other city resources that are available for businesses and for residents and customers. Those COVID ambassadors are going to continue to support our efforts over at least the next 3 months as we go through this Omicron surge. So I hope you be sure to say hi. They'll be stopping into your businesses. Many of them have already done so. And that is hopefully going to be a great resource to assist our customers as they're walking through our town, our squares, and on our main streets, and hopefully can be a resource for you business owners if you have questions about the latest status of COVID and city requirements and assistance. Next slide, please. Well, we're up to questions and answers. I'm going to turn it right back over to the mayor, who, along with Rachel Ned Carney, is going to facilitate the question and answer portion of the event.
Yeah, I'm going to take the first one, Rachel. I read it. It was from Steve Mackey. And I'm not sure about where we're getting at it, Steve, but let me answer directly. Does anyone know who wrote this? Yeah, I know who wrote it. It's the City of Somerville administration the other day. People appointed under my administration. We have close coordination and the input of the incoming mayor. We took the model on Boston, Health and Human Services, and Somerset updated some of the clauses, and legal put it in the proper form and paper. And I'll just be clear, Steve, to you and others, as we have done with every other order. So we can take the next question. Thanks for the questions.
Why don't we go? We have two hands up at the moment. The first is Joe Carrera, and the second is Sheila Foley. So Joe, I'm going to, Joe's hand is down at this point, and back again. Joe, I'm going to go with you first. So I'm going to give you the mic one moment.
I'm going to defer my time to Sheila first, and I can go afterwards. I want to make sure Sheila has an opportunity to comment.
Okay, thank you. Sheila, I'm giving you the mic.
Okay, thank you. I could see that this is definitely gonna go through. I could see it as it's bigger than just Somerville, and I'm fully vaccinated, and I'm for this. I'm for our safety. I just want to know something. I went to Disney on Ice this weekend, and they gave us two options. You either had to show your vaccine card, or you had to show proof of being negative. I really think you guys should really think about this. Give people an option, because the people that I talk to on a daily and really don't want this vaccine, they're going to figure out ways to give you guys fake cards. They're going to figure out a way to not get vaccinated. I'm telling you, it's gonna, at least I feel safer knowing that somebody's not, that they don't have the COVID sickness. They're not sick when they're sitting in my place. I know this is going to go through. I'm not even going to fight this. I mean, I want to for my restaurants. This is going to kill us. This is going to kill the restaurants. It's going to kill us. It's 100% going to kill us. But again, I do what the city asks me to do as a restaurant. I do what the city asks me to do. And I just ask that you please don't close the door to just, we're not even trained to look for these vaccines and IDs and all this stuff. This is not going to go well with our industry. Our industry is going to suffer. It's going to hurt unless you're hiring somebody to stand outside these restaurants all day, every day. We can't afford to put somebody there. I don't know what your plan is, but this is going to be really bad for us. I'm not even going to ask you not to do it because I know it's going. I know that. I mean, we can be sued as an establishment. All of us can be sued for asking people to show us proof that their service dog is really a service dog. We can get sued for that. We're not trained for this. Just please, in the end, this is going to kill us. I'm okay with it. I understand where we're going with it. I know where you guys are going with it. You're in the right, you're where you're supposed to be because the whole world is going there. However, please give us a chance and let us ask for a negative result at least so that we don't lose everybody. Thank you.
Thank you, Sheila. I'll take a crack at it. But thank you, Sheila, and I appreciate your partnership. And we recognize there'll be some challenges, which is why we're going to be committed, as we did before, to work with all of you to understand how to do it. I do want to, on a couple of points you brought up, a vax or test option has been discussed before submit from the input we got. It could be make things more complicated for businesses. Should it be considered moving forward? I'd submit to you all that's also input to provide to the Board of Health. That doesn't stop any establishments for providing those tests if you want to further secure a certain safety of who's coming in and whether they're infected or not too. I hope everyone's taking advantage of the COVID relief funds of businesses. We've done something unprecedented. And our goal, we certainly recognize that even though we did that and we've lost fewer, in this example, restaurants than most places, that doesn't mean it's not a strained industry. It's stressed anyhow. It's hard to run a restaurant. We understand that. So we're prepared, and speaking with the mayor-elect, economic development, prepared to move forward further on that. There's an expanded round 3 and understand how we can help you all do this. And that's why we didn't come out with some arbitrary number or in terms of what it be. Do people need staff to do this? You were great at providing this input for us during the reopening phase. Is there a common app or platform people could use? I will say this, we'll disagree from what we're hearing. I'd submit if some of those establishments and let's say a town next to us doesn't want to move forward with that, and ask ourselves, I know how I as a consumer act. If I knew a restaurant in Somerville versus a restaurant next door, by the way, I think the restaurants in Somerville are better than all of them. And I'll say that candidly, but if they were safer for their workers, for their customers and the public, and I can go there with my family, that's where I'm going to go. And I can tell you even the other day, with Omicron surging, we had takeout, we didn't go out. So we recognize there might be some challenges, but we are all in on resources and coordination, as the mayor-elect also mentioned, to work with you. But I appreciate that input, and I encourage anything else, advice in terms of how you think it can make it even safer. As part of an order, you should submit that to the Board of Health. Thanks.
Next, we have Joe Carrera, and then I'm going to go to a couple of the comments we've gotten in by the message. One moment. So, Joe, you should be able to unmute.
Thank you. Although I appreciate my friend Sheila's remarks, I unlike her, I'm not willing to give up. I feel this particular order as written is inequitable, and it's very onerous for the industries that it's regulating. It's putting an undue burden on those industries and implying that we're unsafe. The restaurant and entertainment and fitness industries are among the safest, and there's no statistical or scientific data to show that the spread of any of the variants or of COVID is increased in those settings versus other settings like grocery stores or other types of establishments. And I just think that the onus that it's putting upon our staff, our staffs, would be just overwhelming. I've spoken with many restaurant owners across the state, and many employees feel the same way, that they don't want to be put into a place where they have to, ask customers for this because of the negative feedback that we get every single day from customers who are, anti-vaccine or don't want to put on their mask or don't want to cooperate or behave in a way that's appropriate. And, the concern that many of my staff said is they would rather quit than work in an establishment where they could put themselves at risk, because it's really not as clear cut as I believe that you're making it out, Mr. Mayor. If the purpose of the order is to keep us safer, it doesn't meet those qualifications, because now you're going to have a bunch of unmasked, potentially vaccinated people, but the variants can spread among vaccinated people. Okay. If the purpose of the order is to try to encourage people to be vaccinated, why is it only these industries that have to enforce that or be deputized by the municipality to do that? It's unfair. I mean, my personal experience, I've walked into grocery stores in the city and there are unmasked people there. There are people not wearing their mask properly, but yet the city's not doing anything to enforce that. And I've gone into other entertainment and restaurant industries, and I'm not going to name names, but in Assembly Row, which I know the Board of Health and the building department has turned a blind eye to. And as recently as 2 weeks ago, I was in an establishment on Saturday and nobody was wearing a mask except for myself, my wife, and a few people in our party that had come in. And nobody was asking at the door. There were no waiters or wait staff. There were no management walking around. And this establishment, it was just very unsettling as a person who works very hard to make sure my small restaurant in Union Square is compliant with these things. and yet these other businesses can get away with it. I do think a more prudent way of doing this is to enforce the regulations that we have, like the mask mandate. I would even be willing to go back to, safety regulations where we have to have social distancing and things like that. Because when all of those were in place, Mr. Mayor and Ms. Mayor-elect, restaurants weren't spreading this, fitness centers weren't spreading it, but we were able to survive and exist. And we had a very cooperative public. I think what we're going to have here is a very uncooperative public in an industry with staff that are just not prepared to be able to enforce this. And it's just not going to accomplish anything that we're seeking to do. And I understand, Mr. Mayor, you say I should address my comments to the Board of Health. I was present at the last meeting and I was very vocal there. I've written a 4-page letter that I've already forwarded on to you, your staff, and to the Economic Development Department and to the Board of Health. And I plan on being in attendance in any future meetings. And I will respectfully disagree. There was not compliance among all of the Board of Health members as if they felt like this is, a gimme on the 14th. There's a lot of questions, even among the Board of Health members, as to the exclusions that were carved out and how are those fair and how are those applicable. And there's also, disagreement as to whether or not this is the best way for our municipality to go. And although I do understand that we want to have community collaboration, you yourself, Mr. Mayor, were very adamant and very vocal about saying Somerville first. And the way that we do things in Somerville is unique, and we don't have to follow what the other municipalities do. And I think here is a place where we can be leaders and show that we don't need to go to these mandates, which are going to hurt our businesses, and instead be supportive of our businesses by enforcing the mandates that are already in place, putting in other safety regulations, which you have historically done with great success in Somerville, and allowing us all to survive and to work. Because no matter how much money that the city has left over or is going to have, there's no way that you can employ security details to basically help out every single one of these restaurants, entertainment, and fitness centers to enforce taking people's vaccine cards at the door. So I know I've talked, I'm very verbose, so I'm going to let myself stop right here.
Well, thank you, Joe. No, and first let me clarify. I want to make sure in saying to the Board of Health, that doesn't mean we don't want to hear you, to make sure you put it on the record there. That's also important. So let me clarify that too. Let me just say a couple of things. We're not asking and first recognize there's been incredible sort of the treatment, terrible treatment of workers around various industries for people who are required to wear masks and take other measures. That won't be tolerated here, and we're not asking you or your employees to do that. I understand and recognize how the effect may be in some places, which is why, in terms of how we work together and understand what we can help to coordinate, whether it's funds or so forth, if it's more staff, using common apps, and we send a very clear message. I do want to say a couple of things. I do want to make sure that Nick Antonelli talks about compliance, because we do enforce. We've been out there in all our data shows that we're engaged in educating people, our ambassadors, we get compliance. I've seen non-compliance myself, not just in Somerville, other places, and I reported that in. That's also part of a societal abdication of our responsibilities in elected officials at the highest state. The reason cities and towns are leading it, because the state has taken the approach in the beginning that 351 cities and towns should figure it on their own. 400 school districts should figure it on their own. And Somerville has led that. And I'd submit to you, we are leading it here. I agree, in my personal opinion, we should be requiring it across the various industries. This is one step and one additional layer. It's not in lieu of masks. Mask order is still in effect unless when you're eating in a restaurant. These are all good points and we recognize them. You should also know that we've had direct conversations with New York City's representatives, not just the city of Somerville, but regional and statewide municipal leaders with their CIO, who informed us their feedback. We wanted to learn from them what worked, what didn't work. That their businesses were initially very concerned and there was pushback, but since then since it's gone into effect, they've received positive feedback from businesses that have been covered by their order, and they're seeing great consumer confidence in the impacts of that. So we need to work together. This is another layer. I mean, COVID will find a way, and the unvaccinated population is compounding the problem, quite honestly. And these industries aren't done in a vacuum, the selections. It's based on the input from experts. That doesn't mean I don't agree that others should be on it. And the Board of Health can do that if they want. But thank you, Joe, for that. Well, I want to stay on time, and I appreciate the comments, but we want to make sure the questions are answered. So I'll hand it back to that point. If you want to take the next question.
Mayor, we have several questions that have been written in about enforcement. Would this be a good time to talk about that?
Yeah, Nick, and let me just say this. Ryan C. asked, do we have an estimated timeframe when the proposal will become official? So we have time to prepare. Ryan, the dates you saw there, what was proposed, I wouldn't be surprised. I don't know what the Board of Health is going to do. I suspect they'll put something in effect. If those dates shift a little bit, the goal is to give you as much heads up as possible and work together on that. So, since the next meeting is on the 14th and the initial date was the 15th, I'd be surprised if that happened the 15th. But let's hand that back to Nick. Thank you.
Good afternoon, everybody. Thank you for attending. Just to talk a little bit how the enforcement of this would work when we're looking for compliance. It's going to be similar to how we've done enforcement throughout the whole process. It's education and communication versus punitive responses. We all know that there's adjustment times and that people have a learning curve, and then just the public as well needs to get in time. So again, we have additional time to people to get up to speed. We'll help with the resources, but then also talking about the enforcement of what's going on out to the city. With what we have and our staff in place, we respond to all complaints as soon as possible. At this time, with the amount of complaints that we get, we are in the process of responding to complaints versus being able to proactively see a lot of these establishments. So if there is any non-compliance happening, please submit a complaint. We will have an inspector out there and then take the appropriate steps once we do arrive in those situations. But all complaints are investigated and appropriate actions are taken when we do investigate those complaints.
And then a related question about enforcement is, what happens if someone refuses to comply when staff at an establishment asks them to show their vaccination?
Well, if an order goes into effect, I'll take the first crack at Nick. If I have an establishment, the order's in effect, and I've asked someone and I have a restaurant or an establishment, then they cannot enter the establishment or be served. And that's the bottom line. And I recognize we can't control how individuals act, and I wish it was different in today's society. That's not the case. Much like someone not wearing a mask when they should be. And it'll be incumbent upon the establishment, much like in City Hall. If you don't wear a mask coming in, you will not be allowed in. You'll be asked to leave. That's in place here, and we enforce that. Next question.
So we have a couple of questions in the comments as well about exceptions. So first off, people with disabilities who cannot be vaccinated, how would that be handled? And then there was also a question about performers and the rationale behind why performers are a call out for an exception.
I didn't hear it all, but on performers and the categories, again, we are trying to be consistent in line with others. That doesn't mean personally I don't believe, I may not think certain exemptions should or not be included. That'll be up to the Board of Health. This is a first step in the region. I'd submit those comments. So valid arguments and input and comments, put that to the Board of Health. In my way, we'd probably be broader across the whole spectrum, but that's not going to be the case. Not to be a statewide mask mandate, be a statewide vaccine mandate. The governor's advocated that decision, responsibility left it to us. I don't think we need to go in more detail on that. I'll leave it to, I didn't hear the other, I thought it's about disabilities and how those exemptions fall into place. Tim, whoever wanted to answer on that. I want to make sure, Rachel, if you can hear me still, I'm going to walk.
Yes, sorry, that was the question. It was about if someone has
Yeah,
a disability and they can't, we can follow up.
Yeah, we'll follow up with that. I thought Tim was on.
Why don't we go back to some of the questions live? So up next, and I will read, we have 5 questions in order, so why don't we jump to those folks there. If everyone could please remember to keep their question really to a question and keep it brief if you can, because we do have 5 folks that we want to make sure we get to everyone. So first on this list is Steve Mackey.
Hello?
We hear you, Steve.
Thank you very much. Thank you, Mr. Mayor, and thank you, Mayor-elect Ballantyne and staff. Going back to the staff's, Sam, I'm sorry, I forgot Sam's last name. The presentation on cases. He did an excellent job going through a summary of the status of cases in the city of Somerville. And I think if people go to the website, the dashboard, they'll see even more data relative to cases and looking at it every which way in terms of demographics, geography, age, time, etc. But that's about cases. And one of the things that experts have begun saying in the past week is we have to do a shift. Dr. Ashish Jha of Brown University, who I believe the mayor is very familiar with and has quoted many times over the past almost 2 years, said over the weekend, we have to do a shift. And while staff said here in this presentation that cases predict, cases, then comes hospitalizations, then comes death. What experts have been saying recently is that was the case for 2 years. It's no longer the case. What you'll have is extensive infections, but they won't be they're not expected to lead to hospitalizations and deaths like the previous 2 years. And I'll give you a direct quote. What Dr. Jha said was, we have to do a shift. Look, for 2 years, infections always preceded hospitalizations, which preceded deaths. So you could look at infections and know what was coming. Even through the Delta wave, that was true because it was largely unvaccinated people getting infected. Omicron changes that. This is a shift we've been waiting for in many ways, where we are moving to a phase where if you're vaccinated, and particularly if you're boosted, you might get an infection. You might get an infection. My repeat. I think we have to listen every day to what the experts are saying. I didn't hear a lot of outside expertise today. I wonder if we're consulting the authorities. I don't hear a doctor speaking. I did hear a doctor speak at the public health meeting on December 21st. And I'd recommend that everybody here that's on this call watch that meeting and hear the members of the Board of Health and their concerns about this measure. There's every confidence. We have the experience of 18 years with just a simply outstanding mayor and administration. And we're looking forward to the most promising new administration. But I think it's important right now because it's an interregnum between those two to ask explicit questions about who wrote this and to follow it up with what are the names behind the words that are on the order that would ultimately require restaurants to decide who was going to work the door or who they were going to hire to work the door or when they were going to close. Thank you.
So thank you, Steve. Let me clear. The name is Joseph A. Curtatone. It's still here through the 3rd of January. All right. We don't do things in a vacuum. I was clear about that, and I want to be direct. And I'm glad you mentioned Ashish Jha, because I speak with him, not so much these last few weeks, very often. And we have engaged experts over the last 20 plus months. You've been on those calls. They've been Ashish Jha, they've been Michael Mina, you name it. Mauricio Santanilla, you name it, from the highest level of epidemiologists, healthcare experts who've got not just the city of Somerville. In fact, Somerville led that in major coalitions around the state. The state never provided that. I promise you, we are guided by the highest level of expertise and advice. I know the new administration will be as well, but I appreciate that. I also want to say, yeah, the question about, I recognize the question about hospital data. We have historically not included that because we don't get that some of the specific data, but we are looking right now at getting the best regional hospitalization data. That is one variable. However, the problem about relying on hospitalization data alone, it's important to understand because we don't want our healthcare system to fail, which was the major concern at the beginning of the pandemic, amongst others, like we saw in Northern Italy, the third best healthcare system. In Europe, we saw life and death decisions being made based on one's age, whether you'll get care or not. But at the end of the day, if we're only measuring what the capacity is at the back end, that still means you're leading to a risk of infections. The more infections, the greater risk of serious illness and death, and other healthcare needs can't be met. Our responsibility, Steve, I'd submit, is to interrupt the transmission of this virus as much as possible. This order is not done in a nefarious way. So I want to be clear. You want to know who wrote it? It comes out of this administration with the input from input from the incoming administration, the experts, the law department, and so forth. Call me if you have any other questions. I want to be clear about that. And we are guided by that. We've never made those decisions on our own and never will. I do want to add one other thing about Geraldo Cordero's question about how to deal with someone who might have a disability exemption. We're going to have feedback on that soon. We're going to ask that question on how to best address that. But that's the type of input we're going to need moving forward, how to achieve compliance and do so in a way that addresses every possibility. Let's use the last few more minutes here. I'm going a little over. I want to make sure we do it. Rachel, take a couple more questions. And anything else you have, folks, you can certainly send in via email. We'll answer and get back to you.
We have 4 more people who want to speak, and so I'm going to ask everyone to keep it very, very brief. I do want to make sure we catch one other question that's been in the chat. One of the questions we've had is about the employees and how does this affect employees, specifically in addition to customers.
I'm sorry, if I understand correctly, so whether the order applies to employees, it applies to all, yes.
Okay, correct. Thank you. All right, Mateo is up next, followed by R. McLean.
Hi there, can you hear me?
Yes.
Hi, thank you. Thanks for having this kind of open discussion today. I appreciate it. You know, I'm really concerned about kind of where we're headed and specifically what bills, you know, introductions like mandates such as this are going to do to, you know, personal freedom and health choices, which to me are hallmarks of our country. You know, there's a whole saying that I know a lot of people in this area say, you know, everywhere, my body, my choice. You know, where does that come into this situation? You know, it's my body, it's my choice. People don't want to get an injection from pharmaceutical companies that are held completely, you know, zero liability for their products. So if you don't want to have that, then you're basically cut out of society. And, you know, I don't think that's right in a free and open society. If it was really about health, you know, fully 100% about health, I think we'd have, you know, some other interesting conversations to have. Like, what else are we going to put on some sort of passport like this? Maybe you put like BMI, people's body mass index, which if you look at the data is directly correlated to your COVID outcome. But we all know that's not right. You know, it's not right to limit, you know, people living their lives and their freedoms based on their own personal health choices. So obviously we're not going to put people's BMIs on some sort of digital application or whatever like that. You know, if you look at the data, if you're vaccinated, you can still get it, especially with Omicron, you can still pass it. And yes, there are people dying of it. You know, there's a reason why countries like Israel and across the world, like they're on 3 doses, 4 doses, 5 doses, 6 doses. To what point is this going to go to? I think this sets actually a horrible precedent for a free country, like where we are in a free place, you know, the birthplace of the nation. And, you know, this sets the horrible precedent. What happens when in 10 years, 5 years, 20 years, someone mandates that you take something that you don't want to take, or that your child then has to take something, some pharmaceutical product or some other product, or they have to live in a specific way that you don't agree with. And then it's now mandated. And because of precedents like this. This is, the first precedent in this area, and it's going to affect people. It's going to affect people that are working in these places. It's going to affect people that want to visit and engage in free, open society. And, it's just really not congruent with our values. We've all gotten through this. It's
Mateo,
been
please, if you could come
24
to a
months.
conclusion.
Yeah.
We're running out of time.
Yeah, I mean, I'm just thinking we've had this for 24 months. We've got 90+% of people in Somerville vaccinated. Like, why do we need this now?
So thank you for the question. I'll be honest with you, I probably wouldn't use it in this context, my body, my choice. I think women would probably have a certain opinion of that. However, I understand the point. To be clear, as we all know, there are many vaccines requirements we're required to take, vaccines to take as part of a civil democratic society. As someone who's defended civil liberties in courts for more than a decade, I can't think of anything greater exemplifying selflessness of American ideals and doing what you have to do to protect your neighbor and friends. And why do we need, by the way, it's 80% vaccinated, and fully vaccinated doesn't include boosted. That information coming up soon. The CDC is going to move that way, and I submit that's at some point. The question when, that's a good point. I think it'll become an endemic at some point. And that doesn't mean people don't die from that, but how many lives should we forsake? Our responsibility, I can't think of a greater responsibility in public office than the health and well-being of you, our public at large, your customers, our employees. And this isn't a debate for that day. I appreciate it, but I want to make that clear. And I can't think of anything that would display our democratic and democratic ideals, our free society ideals, and doing what you have to do to protect our neighbors, especially the most vulnerable. My mother's 88. I'd love her to be around for a while longer. We can take one more question.
So we have 4 people still on the list. R. McLean, you are up next. And so unfortunately, this is going to be our last due to time. So Mr. McLean, if you could, Mr. or Ms. McLean, if you could keep it brief.
I don't know, if he heard you at all. He might be muted. I can't see his screen.
R. McLean? All right, we will go to then Stefan G.
Hello, can you guys hear me?
Yep.
Yes.
I think Matteo really touched. I mean, a few of the other folks touched upon the questions, and I couldn't quite get a real answer of when does this end, and eventually an endemic sounds like a hypothesis, but I think it's very, very tough to implement measures based on subjective data because we see a very conflicting data in how different states react to this and the different outcomes they get, and doesn't seem to be any statistical significance with measures like that. And it's all about promoting this fake good and responsibility for your I guess the rest of society, but then in time people will be judged based on this, and people will bear the consequences. Just remember this conversation, and hopefully with emotion that will stay with you for the rest of your lives of what you're just causing other people. You will be judged by history.
I think we can mute him now because I'd like to answer it. I hope they judge us all, Stefan, all of us, in Monday morning court about what we did, why we did it, and what we didn't do. I hope we learn from history. Unfortunately, we tend not to do that. So I'm sorry, but I disagree with you about undercutting American ideals. This is our opportunity. And I will say this, I fully support it. I hope they pass it. And how long it goes, since Steve brought up Ashish Jha, I think he brought up a good point. We need to learn, and others have done, Fauci and every other expert. We're going to be living with COVID in some fashion. And we're going to learn to live smart. This is how you live smart with it, or else, and not be in a situation where we roll back and close activities. And I've said all along, I'm going to tell you, I'll be ethical, what we know, what we don't know, why we're doing what we're doing. We're not here to make decisions on conveniences. Sometimes the answer is not a great answer. I want to remind everyone where we were not too long ago. We weren't even in a position to do this. We're in a position to move forward in the greatest surge since the beginning, where people are still dying. And Omicron is no less severe, as it's shown the Delta. It attacks a different way. The vaccines work. That's why we need to do it. We're so much smarter. We have the tools to be smart. Now we need to act that way. as policymakers, as everyday citizens, as business leaders to protect our workers, our customers, and the general public. I understand you have questions. I respect that many may not agree with that. That's why we live in a democratic society. At the end of the day, I'm confident in what we're doing. Confident next administration will move forward to keep everyone safe. And we're going to work with you. And I hope you'll answer our call as you did before to give us your input on how to implement, consider other measures we haven't thought about now. What are the resources need to work together? There's great opportunity because we have those resources. Before we sign off, I do want to allow Mayor-elect Katjana Ballantyne to say some closing words. And we thank you for joining us today. And any other questions you may have, shoot them our way, please.
Thank you, everybody. Thank you for participating. The hospitals are on an edge of being able to take care of the people. We must also in our communities do everything to get people vaccinated. This is not so much about cases, but this is about the severity of the impact that COVID has on those who are not vaccinated. I look forward to working with you going forward and on this in the new year. Thank you.
Thank you, Mayor-elect. I want to thank the staff and all of you for coming out today. I thank the chamber, especially Union Square Main Street, the Somerville Main Street, all the organizations for participating along in the working groups. We need your help moving forward. The vaccines, folks, and modeling that behavior, we aspire to be other way out. I'm done with COVID. It's not done with us. So let's look after one another. We live in a society where we can disagree and respect that. This country is founded on disagreement and debate, but not when it comes to protecting our neighbors and our most vulnerable. It's all hands on deck. We're going to get through this. Be healthy, be happy, be safe, and let's hope the new year brings greater health and prosperity for everyone. Take care.